Hello dental online trainers, Dr. Dennis Hartlieb here with today's quick tip on blocking out or masking the discoloration for crown and bridge. So I want to share with you a case that I literally just did 2 days ago. This is my patient Lucy. Lucy, we're doing an upper reconstruction. She has provisionals through tooth number 2 to tooth number 15. But what I want to share with you is how do you mask out darkness on a tooth that you're worried about how the ceramics is going to handle the tooth if you don't block it out. So in this first photo I show you, I have the temporaries off on 6, 7, and 8. And let me share with you, look at the brightness that we have on that cervical portion of tooth number 8. So what I want to show next is what happens when I take off the temporaries off the other anterior teeth, especially tooth number 9. Alright, so you should be able to see the darkness at that cervical zone. So tooth number 9 is a root canal tooth. So actually I sent Lucy back for retreatment of that root canal. So you might see that there's still some core buildup material there that I have to finish contouring and polishing. But before doing that, I wanted to treat this discoloration. Because if I leave the discoloration at the root area or the cervical area of number 9, my ceramist is going to have to block out the crown on number 9 to match the crown that would be on number 8. And what I want to do is minimize her efforts so that when she does the crown on number 8, she can do the same technique for number 9 and not have to worry about blocking out that darkness. After I've gone in and removed some of that dark area, I don't have to remove it all. I have to give myself about a ½ millimeter of space. So I'm using a small diamond rounder to remove that darkness. I've rinsed off the tooth, dried it, and now I'm going to place an adhesive. In this case I'm using a self-etch adhesive. I'm using Clearfield SC primer. And I'm using a very small micro brush, and I'm going to scrub my SC primer for about 20 seconds. After 20 seconds I'm going to air dry the primer. And then I'm going to place the second component, the SE bond, the bonding agent. So I'm going to place my bonding agent over that cervical zone. I'll air thin that, and then I light cure it for 20 seconds. Now, here's the key. We're going to use something called pink opaquer. Now, for those of you who've done the dark tooth course that we have with DOT, you're used to using the pink opaquer to block out a dark tooth. But in this case, we're just blocking out a zone. So we're going to place the pink opaquer over the zone that we want to block out the darkness and raise the value. So you can see I'm using an artist brush, and because it's such a small area, I've actually cut off about, I don't know, maybe 70% of the little bristles so that I can go in and just have a little area and pick up a little pink opaquer and just paint it right into the area where I want to block out that darkness. I'm going to light cure that for 10 seconds, and then I reevaluate to see, can I still see some of that darkness coming through? And sure enough, I can. So I'm going to actually go back and place a second layer of pink opaquer. After I place that second layer of pink opaquer, I've light cured, and you can see that that area is completely blocked out now. So that now has blocked out the darkness, but I don't want to leave this color because it doesn't match the surrounding tooth. If I look at this area compared to this area in this tooth, I want to raise the value and block out a little more. So what do I use now? Now I use the opaquer that matches the tooth color of this, which is A1. So I'm going to use A1 opaquer over top of my pink opaquer and blend it onto the tooth structure. So using the same brush, I clean off the brush, I dip it in my A1 opaquer, and I'm going to paint my A1 opaquer so it blends onto the tooth surface and over the pink opaquer. And that's how it looks after it's cured. So now we've blocked out the darkness, we've raised the value in that area, so now I can go back and just modify my preparation. I'm just using a carbide finishing burr from Brasseler to finish my crown preparation. You can see the difference in how that's masked out, that dark zone, raising the value to blend in with tooth number 8. Before I go to take my impression though, I want to go ahead and polish that so it's nice and smooth. So I'll use an assortment of polishing points and cups and wheels. This is a blue point, this is the Flexi Point from Cosmonet. And then using a silicone brush to get a final polish. So that's the final result before we go to take our impression. Now I have a much easier substrate for my ceramist to work with, so that when she's making the crowns, she can just use the same material. She doesn't have to worry about blocking out that darkness, which then just makes it much more predictable when we go to cement the final restorations. So I want to thank Cosmonet for the use of their pink opaquer for demonstrating this technique. Blocking out these dark teeth without pink opaquer is virtually impossible. So with a pink opaquer, we can just paint just a thin layer on there to block out that darkness and raise the value. But then we also need the Vita shaded opaquer, again from Cosmonet, part of their creative color system. Using those two in combination will then allow it to make it so much easier for our lab technician to be able to give us beautiful looking crowns. So until next time, thanks Dental Online Trainers, and we'll see you at either the next mini tip, or we'll see you at the next course. Thanks.